Great. So thank you so much for doing this for us. What we're going to talk about today is your experience with having upper eyelid surgery, also known as blepharoplasty.
Yeah.
So you had that surgery with us. Tell me, first of all, how long had you been thinking about it and what made you decide to have the surgery?
I'd been thinking about it at least 10 years.
Wow.
I had noticed the excess skin getting progressively worse over that decade. And then I became aware of the feeling of the weight of the skin as it folded over. And that really bothered me. And also when I was trying to apply makeup, I would end up with the imprint of the mascara particularly, but makeup wouldn't actually stay in place.
Okay.
And I just felt really self-conscious thinking that when people were looking at me, that was the thing they were noticing. So,
Okay. Fine. So after thinking about it, you decided to have a chat with me.
yes.
When you came to have a chat with me, we discussed the surgery and we discussed the pros and cons. What concerned you, or what things did you have to take into consideration when you thought, right, I'm going to do this, but I have to think about this?
Yeah, so we went through all of the risks that would be involved with the surgery. And so what I had to factor in would be the time off work I would need. And I thought a lot about how I was going to feel with the dressings and how it was going to look.
Yeah.
Being advised of, how the appearance might be. So I had to take all of that into account, fitting it into my day-to-day routine.
So we decided that we were going to have the surgery.
Yes.
And we talked about the risks, which was great.
Yeah.
How did you feel on the morning of the surgery?
I was nervous.
Yeah.
It's a big thing.
Yeah.
It's your face. Yeah, it's if something, like with any surgery, there's a risk. If something wasn't quite right, it's going to be in a very noticeable place. But actually, more than nervous, I felt really excited because it had bothered me for so long.
Yeah.
I was really excited to get this done.
Okay.
Yeah.
And when you came into hospital or when you came into the clinic, tell me about your experience. How did you feel?
I felt really relaxed being here. I felt I'd been given so much information about what to expect, that actually that was giving me the confidence to go ahead. So I just felt completely relaxed and ready to proceed.
Okay.
Yeah.
So you're definitely ready to go.
Yes.
And then we talked about the consent again, just before the surgery. And then we did the injections to numb the area. Now, that can be quite, difficult for some people, but you were fantastic. So tell us how that felt, having your eyelid become numb with the injection.
For me, it didn't feel any different to when I've had blood tests in the past. So you can't have an injection and feel nothing. So obviously there is that feeling, but it's completely bearable. And after that, then there's no feeling at all.
Yeah.
So if you can just be brave enough on the actual injection, then that's it. No more discomfort.
No more discomfort.
No.
So what did you feel in the operation?
So after I'd had the injection, as you'd explained would happen, my eyes felt really heavy and swollen. I think they do swell up, don't they? I couldn't see. And so I was very aware of that. And then through the surgery, just you are aware of the sensation of a bit of pulling, but there's no pain at all. And you were talking to me throughout, and the assistant that we had on the day, she was talking to me. So my heart was racing because you're awake, you are very aware that you are having an incision of your skin. But actually, while we're chatting and because I'm feeling no pain, I'm not really thinking any scary thoughts.
Okay.
Yeah.
And we did the operation and then we put the dressings on.
Yes.
How did you feel when you looked at the dressings for the first time?
I actually felt at that point that my eyes still looked the same, probably because of the swelling anyway. The dressing itself, I had tapes that went over the top of my eye and onto my eyebrow slightly. So there wasn't anything scary about the dressing. It did cover a lot of the upper eye, but it didn't affect my functioning day to day. I can see, obviously being careful not to be bending or picking up heavy things. but the dressing, it was comfortable.
Now, the recovery period, tell me a bit about how you felt when you went home and what it felt like the following day, sleeping and staying up.
I was really surprised that I thought this procedure was going to be painful afterwards. And I actually think that was the most surprising thing to me, that operatively I had absolutely zero pain. Because any time you injure yourself, even a cut, you usually feel it, don't you? And I didn't have anything like that. So with regards to sleeping, you'd advised me that I needed to sleep upright. I was dreading that, I must admit. I do love a good night's sleep. But what I did, I had 2 pillows. And I felt a bit scared that I was going to roll over in the night, because you'd said about sleeping elevated to help with the swelling and the recovery. So what I did, I used a travel pillow that you'd use on an aeroplane to go round my neck. So as well as my 2 pillows, I put a travel pillow round. And so...
that's a really good tip.
Yeah, so actually I remained upright. I know that I was upright for the first 3 nights. After that, I did find I would start off in that position, but I would wake up at some point in the night and I rolled over to the side. But I think I did definitely get the first 3 days in that position. I did stay at home actually for a week, because in my case, although I felt no pain, I did have black eyes. The bruising actually came down under my eye, which was another thing to be expected. And so when I took my dog for a walk, I would put my sunglasses on in February. I'm sure I was very entertaining anyway. And because the dressings are still on, and they're a little bit bloodstained. So actually in that first week, I did just stay at home. I was very careful what I did.
That's really good. And that's really important to do, because the more you do unnecessary things, you are putting yourself at higher risk of infection. So you followed all the advice, which was great. Now, everything went okay and smoothly in the first week, and then you came back to see me and we took the dressings off. How did that feel? Was it painful? We took the dressings off and we took the stitches out.
And there was no pain again. So I felt nervous as to how I would look, excited as well at the reveal. The feeling of the stitches being removed, honestly, it was barely anything, a slight sliding feeling, because this was one continuous thread, wasn't it? Yeah, there was no discomfort at all.
Oh, that's good. And you had a lot of bruising at that point, as we expected. How long would you say the bruising lasted for before it settled down?
I think 2 weeks, but by the end of that 2 weeks, where a bruise naturally changes colour, you go from the bright purple through. If there was any remnants, it was just the yellowy sort of bruising at that point. So
for about 2 weeks. What about for you, what about the prominence of the scars?
I was amazed, actually. I couldn't actually see the scars. When the dressings came off, I was so happy that I still looked like me. But
that's really
even though my eyes did look completely different, it still was me, because that's another thing. You think, when you've had a change to your face, will you still feel like you? And I definitely did. The scars, so at that point, the skin is sort of in still slightly, so it's not visible at all. But even as the swelling still receded and it became visible, it's just a small, very small red line. And when your eyes are open and you're talking to people, that's not really noticeable.
And when did you notice, would you say, the final results came into?
Well, I remember that I was not using any makeup to cover any scarring by 3 months, which I was amazed at how quick that was. And when I say cover up, it's only that you get that small piece just on the side. Within the socket, you don't actually notice that anyway. At 3 months, because I went on holiday, so I remember that quite well.
And what would you say was, I always ask this to everyone, what was the worst part of the whole process?
I almost feel, I mean, it's not the process itself, but perhaps your nerves around having a procedure, because it is quite a scary thing. So after that, I would say probably the having to sleep upright and maybe the dressings, because they just get a little bit irritating as the week progresses while they're on. Those would be the things that stand out. But even then, that's not really anything
And how do you feel now that you've had it?
Yeah, amazing. I hadn't made any secret of the fact that I was having it done with my close friends and family. But for people that I hadn't mentioned this to, they didn't even notice, other than to say, you look really well. Because for me, it hasn't changed how I look, but it makes me look more wide awake. I notice it because of the makeup and the not having the heavy feeling. That's gone. But for other people, they almost can't place the change.
Right.
It's just that, oh, you look really well, refreshed.
Yeah.
I think it's just been the most rejuvenating thing I could have done for my face.
Brilliant. Anything you want to ask me?
Would this be a process I would repeat in the future?
That's a really good question. For some people, as they get more mature and you've got weight change, weight gain, and your skin laxity does change as you get older. So in about 10 to 15 years' time, you might find some bagginess, particularly on the outside of the eyes, and you may need a revision at that point.
Yeah, that's a long time though, isn't it? Yeah, lots of time.
Yeah.
And with aftercare and products, I've been using a vitamin C, a Tropic eye cream, as well as all the plant-based healthy things for my skin. But it said that the vitamin C helps with the pigmentation and brightening.
So that's the Tropic range that you use.
Yeah, so are you happy with that as well?
I'm perfectly happy with that.
Fantastic.
Great. Well, thank you very much.
Thank you.
Bye.